Hello, Adriana.
Hi, yes.
Hi, I'm Dr. Beachy.
Adriana, nice to meet you.
Good to meet you. I'm working with Dr. Smith today, and I figured while we were waiting for him that I would take this opportunity to maybe introduce you to the services that CHCW offers. So I'm a psychologist by training, and my role here is as a behavioral health consultant, which basically means that I work with Dr. Smith and the medical team to help people improve their health.
Okay.
Emotionally, physically, socially, just anything with regards to health. And I figured, since we have a few minutes, maybe we want to come up with a little plan for helping you improve your diet, or maybe getting back to exercise or stress management, something like that.
Yeah, so I've been actually looking into getting a gym membership. Before I was very fit. Now I kind of, lack on it just because I am attending school full time and working school full time.
Oh my goodness.
Yeah, so it's kind of hard for me to, get back on track with the gym. So right now that's my goal, to get a gym membership and, to start getting back on track.
Sweet. So we actually have a decent amount to talk about. I think that if you're okay with it, I can ask you some basic questions to kind of get to know your situation better.
Okay.
And we can actually have you leave here today with a plan for getting back to the gym.
Sounds like a plan.
All right. I'll make sure I share that with Dr. Smith so that he kind of knows what we've been working on.
Perfect.
All right. So first question, so we can get started, is who you living with?
I currently live with my mom.
All right, so it sounds like we have a really good plan here. So I have listed each step. So number one, you're going to call and buy the membership. Second thing is that you have agreed to go with boyfriend to the gym after work on Tuesdays and Thursdays. And then lastly, when you come back in with to see Dr. Smith in about 1 month, I can just check back in and kind of see how that plan went for you, if that sounds okay.
Okay, yeah, that works.
All right. Any other questions or any other thoughts?
Not at the moment. This was very helpful. Thank you so much.
Okay.
It was very nice meeting you.
Awesome. You too.
Thank you.
One of the reasons that we try to encourage behavioral health providers to be more proactive and get into the room and actually meet patients where they're at is because there's all this time that exists, and might as well use that time to get something done and be more preventative. A lot of times in medicine, we have a tendency to be reactive instead of preventative or proactive. So this is a really good opportunity as a behavioral health provider to insert yourself into the medical culture and to kind of announce yourself as, hey, I'm a member of the primary care team. Here's the services that we can offer at this clinic. And a lot of times patients want to know about what resources the organization, their healthcare organization, has. So introducing yourself to patients while they're waiting, or while maybe the medical provider is running behind, is a great way of, in some ways, marketing just what resources they have and giving an opportunity for the patient to improve their health and get better, more from a preventative stance. I think that there's some very specific techniques and strategies that you can do if you're introducing yourself to a patient who you've never met before. One of the ways that you do it is obvious: be friendly, be open, make good eye contact, introduce yourself and identify yourself as a member of the primary care team, and let the patient know that you're working with whatever provider they're coming in to see today. So for example, if a person has an appointment with Dr. Smith, you're going to want to make that connection that you are in fact working with Dr. Smith and the rest of the medical team on this issue. So in addition to kind of being confident and being friendly, making good eye contact, you're absolutely going to want to establish that connection of the team. And the second thing that you're going to want to do, honestly, as a behavioral health provider, is reduce the stigma. Because at the end of the day, behavioral health is so much more than helping people deal with substance use or mental illness. It has everything to do with helping a person change their behaviors in a way that helps them to be as healthy as is humanly possible. And so taking that approach into the room is, how can I help this person in front of me improve their behaviors, which improve their health, whether it be physical, mental, or emotional. It honestly doesn't matter. What matters is that they're moving closer towards wellness.